Good morning, everyone. This is Heather Drake, the Membership Manager with Maine Public Health Association, and I'd love to welcome you all back if you've been attending already to our 2020 annual conference, and welcome to anyone who's just joining us for the first time this morning. We're excited to have a wonderful panel here to talk with us about public health nursing. Before we begin, though, just a couple reminders to please complete the session evaluation. You can find that by clicking the feedback button, and that's in the same spot where you access the live stream for this event. And if you have any questions, please feel free to enter them in using the Ask feature. You can ask those throughout the session, and then we will take those at the end. But with that, I'd love to introduce Martha Eastman, our moderator for this morning. She is a nurse practitioner and an aging life care manager and owner of Pro Elder Consulting. So thank you, Martha, and thank you to our panelists.
Good morning. It's nice to be here. This session has been approved for one contact hour by ANA Connecticut, and the attendance will be recorded. And please do complete the evaluation because that is required for the continuing education. Here are our objectives. We will highlight the history of public health nursing in Maine over the past century, update you on current public health nursing activities, and offer a vision for the future of public health nursing, particularly how we anticipate public health nurses will contribute to Maine's health going forward. We have no disclosures. And I'm going to skip through this because we've already talked about the continuing ed. Let me introduce our panelists. I'm a former public health nurse, and my dissertation included much about the early public health nursing history in Maine. Jan Morissette is a former director of public health nursing at Maine CDC and also a Robert Wood Johnson Nursing Leadership Fellow. Patty Hamilton, a longtime public health nurse and family nurse practitioner, is now director of public health for the city of Bangor. And Catherine Downing, an accomplished nursing leader, is the current director of public health nursing at the Maine Center for Disease Control and Prevention. Let's look now at the beginning of public health nursing in Maine and how this work developed. By 1920, various voluntary health organizations already provided public health nursing services in Maine. Lillian Wald of the Henry Street Settlement in New York City had coined the term public health nurse back in 1893. And at Wald's suggestion, the Metropolitan Life Insurance Company supported public health nursing for its industrial policyholders. They wanted to keep them healthy and on the job. And this was also true in Maine, particularly in communities where there were many mills. Before 1920, many of the earliest public health nurses in Maine worked at tuberculosis clinics and dispensaries, and they made home visits for TB control. This 1917 illustration accompanied an article titled Doctor versus Nurse or Doctor and Nurse. And the article acknowledged that this desired collaboration didn't always happen. The Maine Anti-Tuberculosis Association wanted to recruit a public health nurse in every Maine community, and their publication usually included a list of dispensaries. You can see here somewhere coming soon. Many voluntary organizations and civic groups supported the emergence of public health nursing, including the Maine Baby Saving Society, which existed between 1921 and 1937. Club women offered programs to highlight the benefits of public health nursing and even provided housing for the nurses when they came to town to host well baby clinics. After World War I, the peacetime public health nursing program of the American Red Cross supported local chapters that wanted to establish public health nursing in their communities, and they hoped that these services would stimulate the growth of official public health nursing work. By 1920, public health nursing was an elite specialty that required specialized training and qualified supervision. Dr. Welch, who started the Johns Hopkins School of Hygiene and Public Health in 1916, commented, "America has made two great contributions to the cause of public health, the Panama Canal and the public health nurse." Dr. Welch's affirmation was evidence of the growing awareness of the contributions of public health nurses nationwide. In 1920, with funding from the American Red Cross and the Maine Public Health Association, and this was formerly the Maine Anti-Tuberculosis Association, Edith Soul was hired as Maine's first director of public health nursing and child hygiene. Soul was already a well-known nursing leader in Maine. She had served as president of the Maine State Nurses Association in 1919 and also as chairman of MSNA's Public Health Nursing section. With no staff of her own for the first few years, her job was to oversee the work of all public health nurses who worked for various agencies, including those of the Metropolitan Life Insurance Company, the Red Cross chapters, and local organizations affiliated with the Maine Public Health Association. Ms. Coles, quote, Ms. Soul said, "I'm sure we have no greater agents in the state through whom we may extend the health program of the state than the public health nurses." Since Aroostook and Washington counties had the highest infant and maternal mortality rates in the state at that time, Soul decided to start there. She wanted to recruit a nurse who spoke both French and English for Aroostook County, but was unsuccessful in the first few years. In 1922, she hired Nora Rowell, a graduate of both Central Maine General Hospital School of Nursing and the Simmons College postgraduate public health nursing course, to work in Washington County. After a brief orientation, Rowell began an extensive survey of maternal and child health in 13 towns. She investigated water and milk supplies and the working conditions at factories employing women, as well as general sanitation and health. Rowell spoke to groups of mothers about infant care, visited homes, and held clinics for infants and preschool children. Besides earlier activities for communicable disease control, Rowell's work was the first outreach of the State Department of Health, bringing health education services directly to rural families in their homes. By 1923, when Aroostook County still had no public health nurse, Soul considered sending a French-speaking nurse to a postgraduate public health nursing course. Rowell had also left Washington County by this time, making both positions vacant. When a candidate from Boston with previous rural health experience asked if the state would furnish a car for her use in visiting the towns, Soul wrote to Governor Baxter and requested cars for the field staff. Later, when the governor asked what transportation the nurses had been using, Soul explained that they could walk or take a taxi in cities or towns, but for rural work, hired cars would make the expense prohibitive. Edith Soul convinced the governor that cars were needed, and soon there were 2 Ford automobiles. By the mid-1920s, 29 Maine communities had established local Red Cross chapters, and many were developing public health nursing services. There were frequent interruptions when staffing became unavailable or when annual fundraising fell short. In those cases, the State Division of Public Health Nursing would step in, sometimes only temporarily or for particular services, such as school health or well child clinics, or at times permanently, adding to the state public health nursing territory. Providing health education to community groups helped public health nurses gain the trust of townspeople, and over time their work became well known. For decades, public health nurses taught the popular American Red Cross course, Home Hygiene and Care of the Sick. This community education increased people's understanding of health recommendations and hygiene practices, improved the image of public health nurses as health resources, and increased the acceptance of public health nursing initiatives. In 1940, Helen Dunn, a native of Augusta, returned to Maine to follow Edith Soule as the second director of public health nursing. Dunn had 2 decades of nursing experience, including tuberculosis work, industrial nursing, the Harvard Surgical Unit in France during World War I, Red Cross public health nursing in the Virgin Islands, and overseeing Red Cross public health nursing services in a territory that spanned 4 southern states. Dunn provided strong leadership, particularly encouraging public health nurses' community involvement through developing helpful local contacts, establishing local well child clinics and town health councils, and encouraging her staff to take initiative to get information out to people about health promotion and disease prevention. There is much to tell about the history of public health nursing in Maine over the past 100 years, more than we can cover in this session. Maine's official state public health nursing division has survived meager funding and political threats, but with new leadership, it is again going strong. In addition to telling about the more recent history, we want you to know about current activities and public health nursing's goals for improving Maine's health. Now we'll hear from our panelists, starting with Jan Morissette.
There we go. Thank you, Martha. I'd like to share a little bit about my background. I had a 26-year career in Maine public health nursing, and prior to that, I had experience in home health, worked in labor and delivery and newborn nursery in a hospital, and did some teaching. I started as a field nurse in the mid-1980s and spent 16 years working in the field. Then I completed my master's in nursing in community and family nurse practitioner from Husson University and transitioned to administration in public health nursing as a PHN consultant and then as the director from 2005 to 2011. And I'm a Robert Wood Johnson Executive Nurse Fellow 2005 to 2008. Since leaving PHN, I have taught in BSN programs, community and public health nursing, and have been involved in PHN advocacy work. I'm an advanced public health nurse board certified, and I'll discuss a little bit about the certification a little later on. I think my passion for public health and public health nursing began with my work in the hospital when I was working with families and their newborns, getting them ready to go home and learning about the unfulfilled needs at home. I came to realize the impact of the social determinants of health. And I have always been had a strong belief in social justice. And a little bit of my passion, I think, is in my genes, as my mother was a public health nurse for the state of Maine. And I remember seeing her uniform complete with hat, hear her stories, and saw her working in the clinics. Public health nursing public health nurses make many contributions to Maine's health by their involvement in various health initiatives by promoting and protecting the health of populations. Every day is different, and they utilize their knowledge of nursing science, social science, and public health. They are often called upon to respond to emerging needs. Now I'd like to just share some of the initiatives and contributions during the time that I was in public health nursing. As Martha pointed out, maternal and child health historically has been the focus for public health nursing. When I started in PHN, universal home visits were offered to all newborns and families, with the focus of positively impacting the risk of child maltreatment, infant mortality, low birth weight, and the health status of the child. Through budget impacts and political influences, services have changed. Today, public health nurses are also providing services to the substance affected babies and their families, one of our most vulnerable populations. We've always worked with outbreaks of infectious diseases. And have you ever wondered why it seems like it's always Friday afternoon that you get notified of one of these? I remember a time when I was working out in the field, it involved a summer camp. We have a lot of summer camps in Maine, and we have campers that come from Maine, across the nation, and across the world. We were notified that a camper had been sick on an airplane coming in to Maine. Subsequently, at the camp, was isolated and diagnosed with measles. Public health nurses were called upon to go to the camp, review the immunization records, health records, and we worked collaboratively with the immunization program to stand up a clinic and immunize the campers. We contained that immunization incident and with those activities. H1N1 in 2008 has been discussed a lot recently with the pandemic that we are experiencing. And as you remember, H1N1, children were the high-risk population for that influenza. Clinics were needed to immunize the children, and public health nurses responded with 238 clinics, and 134 of them were in schools and communities. Also, they assisted with vaccine distribution and storage. At that time, we had 13 offices across the state, all with refrigerators, and public health nurses who knew how to care and keep vaccines safe. They were able to store the vaccine and have it readily available when communities needed it to stand up their clinics. So through these activities, alliances and bridges were built and strengthened with healthcare providers, schools, town officials, and the residents. Public health nurses are flexible, creative, and team members. In an election year, Public Health Nursing Program had applied for a Robert Wood Johnson demonstration grant to organize, promote, and implement influenza vaccination clinics near polling sites. And we received one of the 15 grants, the nationwide grants that were offered. So public health nurses worked within their communities, identified 8 polling sites across the state, got the clinics ready to go, provided the information and advertisement so that voters and residents would know that this would be offered. And then about a couple of weeks before voting time, there was a vaccine shortage in Maine. So public health nursing willingly relinquished our vaccine that we had set aside so that it could be used for the high-risk population, and we changed course. So now our focus was preventative health education information on how to stay healthy during the flu season and additional information on adult immunizations. We purchased some hand sanitizer, tissues, distributed information, and also gave information to the residents on where they might call a hotline to find out where clinics were being provided. Our public health nurses also worked on those hotlines at that time. We did a survey to see how our activities, what our activities might have accomplished. And we found that 52% of the respondents had received a flu shot in the prior year. There was an overwhelming majority, 92%, expressing an interest in having a flu shot clinic at their polling place in the upcoming year. Public health nursing has been involved in TB control activities, as Martha pointed out, and today public health nurses provide services, contact investigation, testing, surveillance, and education. Environmental hazards is another area where public health nurses have responded and do respond. I remember a time when I was out in the field, there was a mercury spill in a neighborhood, in a residential neighborhood in the town that I served. Public health nurses were dispersed. We went and we provided information and went door to door to the residents and did our concentric circles, charted and worked out to find out who might have been involved, have been in contact with the mercury, and gave them some information about the hazards of mercury. Residents were waiting for information. When we got there, we heard them say, "The nurses are here to help us." Floods, ice storms, we have them occasionally. Public health nurses are out in the communities, checking on residents, especially monitoring the use of generators and carbon monoxide poisoning, which is the leading cause of death during one of these times. With new threats after 9/11, Public Health Emergency Preparedness Program formed. Public health nursing partnered with them, and we shared a public health nurse, half-time with them, half-time with us. Our immunization clinics became training opportunities to practice mass clinics in the event of a biochemical threat. Public health nursing participated in drills and tabletop events. Relationships were formed with MEMA, Maine Emergency Management Association, um, and the local agency and the local EMA. Public health nurses do not work alone. Collaboration with others in the community, county, and state, all is needed so that we may provide the services to our populations. Now, a little bit about certification for public health nurses. The certification that was offered through ANCC has been retired. Presently, there's no national certification for public health nursing. Some states may require a formal certification, as California does, and they do that through their Board of Nursing. And Minnesota Board of Nursing offers a registration for public health nurses for their RNs. There are certifications in public health, but not the certification that recognizes PHN as a specialty. A CPH, certified in public health, is offered by the National Board of Public Health Examiners. In September of 2009, Maine Public Health Nursing Program achieved national accreditation in clinical standards of excellence with the Community Health Accreditation Program, CHAP, including a commendation for exceeding the requirements of one of the standards. The public health nursing program objectives for seeking accreditation were to increase PHN's ability to respond beyond emergent public health issues, to focus on strategic organization issues, to improve standards of nursing statewide, and to be better prepared for resource allocation in a dynamic environment. We wanted PHN to be the best in the country serving the people of Maine. We were the only state PHN program to achieve voluntary accreditation at that time. Maine CDC since then has been accredited by FAB, Public Health Accreditation Board. However, that does not accredit a clinical component such as PHN. Past, present, future. Public health nursing stands ready to provide services to promote and protect the health of Maine people. Happy 100th birthday, PHN. And now I'll turn this over to Patty Hamilton at Bangor Public Health. Patty?
Thank you so much, Jan. Every time I talk to you, I learn something new, so that's fabulous. I'm grateful and honored to be able to be invited to speak on the panel today, and I want to extend my thanks to the Public Health Association for hosting, especially on Public Health Nurses' 100th anniversary. And just a tiny bit of background about myself. I think my passion has always been public health. I found public health when I shadowed as a nursing student, and I think I was hooked. I saw people in their own environment, and to me, that was the aha moment as to why some people were able to make behavior change and other people struggled with that. I started my career in Portland doing oncology, and I moved to Bangor and did the same thing for a couple years before I transitioned to home health. I did that for a couple years before I landed my dream job with Bangor Public Health. I worked under my mentor and my friend, Pat Bond, and I hope she's listening today. I hope she's able to link into us. It was understood at that time that Pat Bond was municipal public health, and I miss her, and I miss seeing her in the office to this day. Once at the health department, I worked a combination of part-time and full-time, and I eventually earned my nurse practitioner degree, and eventually became the director of public health in 2014. So I'm pleased to reflect today on the contributions of public health. Mine will be a little more focused on the municipal level of public health and our current activities and some of our future goals. So much like Jan mentioned and Martha mentioned, public health nurses have been the flexible, skilled workforce to address local and state needs for many, many years. Municipal public health is funded with a combination of state and city dollars. And that allows us to work alongside our colleagues with the state public health nursing and identify state needs as well as local needs. Public health nurses serve on many state and local committees, probably too many to mention here. And at the health department, we feel an inherent responsibility to mentor our nursing students from Hassan and University of Maine, as well as our family practice residents who are coming up through the city of Bangor. I looked back through our history briefly, and the first time I can see public health nurses mentioned, and I probably don't have the full history, was in the 50s. We had a public health director and we had 2 public health nurses. And much like was mentioned, they worked on TB, administering vaccines, sanitation, restaurant inspections, home inspections. They used to conduct well child checks before those were popular in the doctor's offices. and we focused on maternal child health. I think that is the right population for public health nurses. It is true primary prevention, and nurses are the ideal profession, in my mind, to do that work because that work requires highly skilled people who have critical thinking skills and have extensive knowledge about maternal and infant child health, normal and abnormal, growth and development. They have to have solid assessment skills, training in many areas, too many to mention here: motivational interviewing, intimate partner violence, ACEs, postpartum depression, as well as knowing all the community resources that exist around them so they can refer people. That is a big lift. When I first started at the public health department, I made those maternal child health home visits. At the time, we also provided school nursing skills to the private schools in our community, and there were 7 private schools. So we did vaccine record review, vision and hearing screening, scoliosis testing, all of that, which was a great learning experience. Other more recent activities included Bangor Public Health hosted the pilot project involving the co-location of a nurse along with what was then known as a Parents or Teachers to worker. So that eventually became the Maine Families Home Visiting Program. In the beginning, they were co-located, which I thought was a really nice model. We served on the work group to establish what is now known as the Cradle Me system. For a while, if you wanted a public health nurse in Maine, there were probably about 15 numbers you had to call, and it was very confusing for people wanting to make a referral. So we established a 1 phone number system, and we were the pilot project to kick that off. Jan was on many of those calls. We established an in-home asthma education program. We looked at our community health needs assessment, and we recognized we had pretty high rates of asthma. We are downstream from a mill, as Martha mentioned, so that for us was an issue. So we received some money, we conducted visits in our region, and eventually that money ran out, and that program has now been adopted for use in Portland Public Health with community health workers, but it did serve a good role for quite some time. Locally, we created maternal child health prenatal education modules, and we had some outcome measures along with that so we could evaluate our own efforts. And as mentioned earlier, for as long as I can remember, I have been involved in vaccinations, from the early ones with Pat Bond in church basements and every other place you can imagine, to the flu clinics that were mentioned with H1N1. We partnered with state public health nurses and the school nurses to hold some mass vaccination clinics with what we had remaining for vaccine. We kind of pooled all our resources together, and we held a clinic at the Civic Center. We had been training and holding drills, so we were ready for that, and we vaccinated 6,000 students a day for a total of 18,000 students over a several-day period. So some more current activities, which I'll try to focus on a little bit. Our nurses continue to work with that maternal child health population, but we've strengthened that work to include education on substance use disorder, medication-assisted treatment, and newer efforts and strategies like Eat, Sleep, and Console to help collaborate and support our parents. We identified mental health as an area of focus. We recognized that trauma was a precipitating factor for later disease. So we sought training in motivational interviewing. We joined the Maine Resiliency Building Network and attended workshops by Dr. Vincent Folletti, learning all we could about adverse childhood experiences. We did a pilot project with Sue Mackey Andrews to incorporate the ACEs questions into our family assessments. And that has been something we've continued since that time. Another local initiative was we recognized that the birthing hospital had given up its car seat distribution program. So although the people were required to have a car seat when they left the hospital, there was no resource for them. So we found a training. I sent a nurse for training. It's a week-long training. Car seats seem to be very complicated these days. And she has continued that work to this day. In the wintertime, we use the fire department's truck bay to hold those so that they're not out in the weather. But that's been very successful. In addition to that, we recognize that not everybody has a car. Some people have to ride public transportation. So we reached out to our Rotary Club, and we were able to raise some funds for some front carriers so mothers could take their babies on the bus to and fro appointments and other activities that they needed to do. A local initiative that we've recently started is providing hepatitis A vaccines in our shelters and in our homeless encampments. We go out with our homeless encampment outreach worker, and we provide those to head off any outbreaks in hepatitis A among that population. And we're expanding that currently to offer flu vaccine, and we hope to do that with COVID-19 when that becomes available. That's certainly a group that's at high risk. At the beginning of the COVID-19 outbreak, our nurses participated in our city incident command and were responsible for outreach to child cares, group homes, and nursing homes. We worked with our state public health nurse colleagues, and we helped develop respiratory protection programs so that when they needed N95s, they'd be able to have them. We provided education on donning and doffing and technical assistance to local businesses and to our city departments. I'd like to mention that public health nursing work is mostly preventative, and we often never know our impact. All these things we're speaking about today, sometimes we never know how they affect actual people. And I just wanted to mention a note that I got quite some time ago. I came back from lunch and I found this note on my desk, and I've changed the names. And it said, "Hi, it's Susie Smith, Tammy's mother. You probably don't remember me, but I wanted to say hi and wish you a Merry Christmas and a Happy New Year. You were the best PHN in the whole world. And P.S. Tammy just graduated from Harvard." I still break up when I read that note, and I've saved that note because I remember Tammy. I've changed her name, but I remember her, and I remember our work together. But they often disappear, and we never hear from those people. So that note was very gratifying. And I share the note to illustrate that although public health nursing as a profession isn't as visible as some other nursing professions, that public health nurses do make a difference. And I've kept that note since 2016, and I'll probably keep it forever. It reminds me that we often never know the impact on the families that we serve, but our impact is real and it's personal, and I'm sure it's multiplied tenfold by the number of nurses that work in Maine today. So a little bit about future goals. We will, of course, continue to use our skills to assess our community and work to meet those local needs, and I anticipate more work with people experiencing substance use disorder and homelessness. I anticipate more efforts to address communicable disease, assisting with outbreaks and mitigating them, and with a focus on mental health and adverse childhood experiences. So again, thank you for the opportunity to join this esteemed panel today, and I'll extend the virtual microphone to my colleague with the State of Maine Public Health Nursing, Kate Downing.
Thanks, Patty. And again, same. I learned so much when I listened to yourself and Jan and Martha. So I truly appreciate this opportunity to be a part of this panel with my respected colleagues. I'm so honored to be here to also celebrate the 100th year of public health nursing in the state of Maine. So as I'm listening to Patty and Jan, I was quickly altering my notes in my own head because I don't want to duplicate too much of what they've already talked about. So some of this, full disclosure, I'm going to adjust on the fly and rework my conversation with all of you. But a little about myself. I began my community health serving in the greater Boston area to some of the most vulnerable populations down there. I worked for the East Boston Neighborhood Health Center in the hospice and home health agency there. And I think that was where my passion for public health was ignited. Except I think I didn't realize it. I was younger then, and I don't think I realized that it was being ignited. For me, it was a job that I loved, and it let me, as Patty mentioned, go into people's homes and meet them right where they were at and start assessing their environment and the area they lived in, and then identifying any public health concerns that might be there. And additionally, because we were associated with a health center in our community, we began to be identified within our own communities that we worked. We were known as the nurses coming in, and they were happy to see us, and it allowed us to assess our communities we worked in and then take that information back to the health center, where many of us sat on boards there in that health center to address particular needs in community, whether it was asthma or a particular area that we identified an emerging health concern in. So I was very fortunate to work there and really had some great mentorship while I was there. I had an opportunity, we worked with all ages across the age spectrum. So I worked with pediatric population, I worked with new mothers, elderly, and then everything in between. We did have a moment in time there. It was a moment where we piloted a program. We were ahead of our times. I don't think we realized it as I do the work that we're doing now. with safe plans of care. I'll talk about those later. That we were tasked with, we began to get referrals for prenatal moms that were deemed high risk. And they were deemed high risk for several different reasons, whether they had had a previous miscarriage, or they had a substance use disorder, or they had had interactions with the Department of Health and Human Services in Massachusetts. Our nurses became involved with these families, and we got involved prenatally, and then we stayed working with them up to a year postpartum. So we were so far ahead down there. I look back now, and unfortunately it was a grant, and we didn't get funded beyond 2 years. So that was unfortunate. I later diversified my background and got into emergency medicine and worked in various emergency rooms from Boston to Maine. And then became intimately familiar with a different side of public health, but still was able to identify those gaps in services on a different level when we would see those repeat patients come in. And I would often think, geez, they shouldn't be here if only they had these connections in the community. And so it was in June of 2018, I had an opportunity to continue with that ingrained desire to come and work for the public health nursing division. I accepted that position. I had no idea what I thought I knew, but I almost 3 years into it, I'm looking back, and it's probably one of the best experiences I've had. Every day is different. Both Patty, Jan, and Martha have talked about every day is different. Every challenge is different. Yes, that phone call comes in on Friday, inevitably, always with the most complex situation that's emerging. But I'm happy to say that every day I'm happy to show up. So that's a little bit about where I came from. Contributions, so much of it has been covered. Jan did such a great job covering those past contributions prior to my arrival here. So I can talk about some of our contributions that we have made more recently. I think about in 2019, we were among the first to greet our asylum seekers that arrived in Portland at the Expo Center. We provided screenings and vaccinations to those new Mainers. It was in total, I believe, thinking back, it was in total 350 new Mainers received assessments, and most of those received vaccinations. We had public health nurses on scene. We got that call we started hearing about it on a Monday, that we were going to have a large number arriving into the Portland area. We worked with our partners down in Portland to quickly put an infrastructure in place. We knew that there would be health concerns that would be essential to identify early on. So we worked with them, and by Wednesday, we had a plan formulated. We had nurses, boots on the ground. We had nurses heading down there, and were up and standing there ready to greet those. Additionally, we had started to work with, we were doing a lot of work around safe sleep. And we knew right away that that was going to be an area that we should really additionally speak to speak to this particular population arriving about how to sleep safely with their children. We had already enrolled in Cribs for Kids to have public health nursing be a distribution source for those cribs. So we were able to work with Maine Families, to partner with Maine Families. They graciously donated cribs, and public health nursing, additionally to providing screening and to also immunizations, we provided cribs. But we didn't just provide the cribs, we provided the safe sleep education that needed to go with those cribs, to meet with those families and educate them about safe sleep and how to keep their babies safe while they slept. So that was some of the work that we did there. We also worked on continuing our safe sleep campaign. We worked with our maternal child health partners to really, a large campaign was rolled out in around 2019 also for safe sleep. So we developed safe sleep assessments that became part of our nurses' assessments when they were going into the homes to make sure that we were addressing safe sleep, which transitioned into the work that we were doing with our clients that had substance use disorder, the drug to clients that had babies that were born drug affected, or newborns that were exposed. We worked with them to develop safe plans of care. We incorporated that work and worked closely with our Office of Child and Family Services. We received referrals from them, but we knew that we needed to develop deeper relationship with those caseworkers to keep families safe out there. So we started to develop more pathways to keep that communication open. That was some of the contributions we made. Both Jan and Patty have spoken to the contribution for vaccine clinics. One of the efforts we did I was fairly new to the program. Again, I'm fairly certain it was, as Jan said, it was on a Friday. We received a call that there was a Hep A concern in the homeless population down in Portland. And we quickly stood up a large vaccine preventative prophylaxis vaccine, Hep A vaccine that we administered over a course of several vaccine clinics that we stood up there. So that was some of that contribution that public health nursing has made. They are always willing to show up and to jump in, and they do it on the fly. And it oftentimes means that they're readjusting their already scheduled visits with their maternal child health clients. But they continue to always impress me at how well they show up. So I'm going to transition more to our current work and what we've been involved in, just for sake of time, because we're busy, we're doing a lot. Patty touched on it about behind the scenes. One of the nurses that works with us, she has been a public health nurse for 33 years, started as a field nurse, and then now has transitioned and promoted into one of our supervisors. She often uses the phrase that if you don't know about tuberculosis in your community, you can thank your public health nurse for that, because of all of the work that they do. So our recent work, we've continued our core functions, which have included our preventative work, our work with our TB control program. We continue to assist with contact investigations. We run LTBI clinics, latent tuberculosis clinics, both in the Portland area and in the Lewiston area. Of course, those are suspended right now as we're not meeting in person, but those are monthly clinics that the public health nurses run. Additionally, more recently, we have been involved with assisting our epidemiology division with their case investigations. We've had public health nurses deployed to assist with those very vital case investigations. One of the other areas we've been involved in recently, 211 provides consultation, and we recognized that they were getting more complex medical questions. We stood up a Maine CDC nurse advisement line. Same as Patty's group, we've also provided education to many of our friends and partners out in the community for donning and doffing PPE and how to do that. We have videos on our website that we've been able to put there for people to go to the website and view. We also worked over the summer with over 100 school nurses across the state to help them develop respiratory protection plans. And we also have that video now on the state, along with the template to walk them through how to do those. And by helping those nurses get those respiratory protection plans in place, it is allowing them to request N95 masks to wear for their work. This past summer in Holton, we were part of a drive-through clinic, a self-swab drive-through clinic. Public health nursing was asked to be on scene to provide observation for those swabbing that was going on, and also advisement and we were there, and they served over 300 individuals during that clinic. Additionally, we are providing catch-up clinics. We, like the rest of the country, identified that our kids were behind on some of their immunizations, and we knew that was something that was essential to get kids caught up. We also recognized that providers weren't going to be able to do that alone, so we filled that gap, and we're able to work with providers in the community to say, if you have an overabundance of calls coming in, we're here, and you can send those kids our way, and we'll get them vaccinated. Additionally, it helped to identify families that didn't have those medical homes. And so we worked with those families, we accepted those families, and we worked with them to connect them with medical homes. So that's been vital and essential work that we've been doing. Flu clinics, we are heavily involved in flu clinics. We're working with a lot of our partners. Of course, one of those have been Bangor Public Health, and we're so thankful for that partnership. We are revving up for a large effort for the migrant farm workers that are arriving. There'll be over 500 arriving, and we will be there to offer flu vaccine if that's something they would like. Additionally, we're working with other large groups such as Volunteers Across America, similar situation, to assist those agencies with getting flu vaccine. So we're working on those. Additionally, we'll have flu vaccine clinics that we're holding at the DHHS offices. So we're continuing to do that work. We had a lot of work started before. Patty mentioned asthma. One of the things that we were starting to get involved with, Maine CDC here, a group here in the prevention division, received a grant specific around asthma, and they had looped in public health nursing as part of that asthma coalition to start delivering education in the homes. That's been paused right now. We're hoping to get back at that. We are working with our partners at OMS. They also received a grant, a Maine Mom grant. So we have partnerships with them to help connect moms and get their care centralized. So we're continuing to do that. And always we're working on our recruitment efforts. We are continuing to hire, we are continuing to interview, we're continuing to onboard new staff. It's looked a little differently, but just this past week we had a new education consultant start, and in the previous month we had 2 new PHNs start. So we're continuing to do that. So where will we be heading and what's next? So we are going to keep pushing ahead, advocating for continued growth within public health nursing to keep our infrastructure strong and stable. And so every bit of focus will continue to grow the public health nursing division back to its previous existence and maybe beyond. I don't know. I hope. I would love to see that. We're going to continue in the vaccination front and vaccination efforts. A lot of these clinics that we're doing for flu, we're viewing them as drills for when COVID vaccine becomes available. So we'll be ready to partner and jump out there and be there to serve and take on that role. And then the other part is really reestablishing public health nurses as those trusted advisors in your communities, that you can call a public health nurse and talk through whatever situation has your concern, and we can either advise you, or if we don't know, we can connect you with those resources. So that's where we're at, and I'm going to turn it back over to Martha. Thanks, everybody.
Thank you. Public health nursing has a long history of interdisciplinary collaboration, community involvement, and outreach to improve population health. In some areas, public health nurses have become increasingly invisible over the past few decades. We are fortunate to have strong, effective leaders working to maintain public health nurses' presence and expanding their primary prevention contributions. Before we go on to our question and answer period, do the panelists have any additional comments to add? Jan? No? Shall we move to questions?
Thank you. I'm all set. Thank you.
Okay.
Me too.
Okay. Heather is behind the scenes here, and she will share with us the questions or comments from our participants.
Yes, and thank you all so much for such a wonderful panel presentation. We do have several questions that have come through. The first one is from Sarah, and she's asking, what are the focus areas of our state level public health nursing program currently?
Kate?
Yep. Sorry, I was trying to get off mute. So we're focused in a few different areas. Obviously, one of our focuses right now, we are working to focus on vaccination efforts across the state for flu vaccine. Director Shaw has spoken frequently about the importance of this. And so we're working to stand up clinics and work with our partners and make sure that if there are agencies out there that for whatever reason cannot enroll in Maine immunization to get that flu vaccine out, that we can partner with them. Another focus we have, we are focusing on our maternal child health clients. We want to make sure that during this time, during this pandemic, that doesn't get lost, and that those efforts, we still need to keep our eye on that in our focus with working with those clients to make sure that we are involved with those families and that we're providing education and making sure that there's a safe environment for those kids. So we're continuing to be out there and focus on our maternal child health visits in those community. And then the third area I think that we are focusing on is the infectious disease area. That again, that falls in that same area. We want to make sure that with so much focus on COVID, that we don't lose sight of all the other potential infectious diseases that are out there, and public health nursing really is essential to be the eyes and the ears and bring that feedback so we can identify emerging trends early on.
Great, thank you very much. And this next one I think could probably be posed to all of you. This is from Christina. She's wondering if you have any advice for an aspiring public health nurse.
Join the team, I would say. It's a wonderful profession. Just jump right in.
When I first applied for my public health nursing position at the city of Bangor, they re-advertised the position because all of the candidates were not as experienced as they hoped. And so my advice would be to be enthusiastic about public health, because when I interviewed with Pat Bond and Bill Shook, I interviewed a second time. And at the time I was passionate about public health, but I didn't have the experience in public health. And so when Pat Bond hired me, she said it was my enthusiasm for the work that landed me the job.
Well, I think for any one that's aspiring to become a public health nurse, just to think of it as that you have the opportunity to be on the prevention end of disease and events, rather than on the other end of taking care of individuals after they become ill. And being out and working in the community, as all of our panelists have said, is a privilege to be working with community members and visiting our clients in their homes. It's a different type of nursing. It's different every day, and you have an opportunity to utilize your nursing skills to their fullest extent, and you have independence to be able to make some decisions on what kind of care you're giving in consultation with your client, as well as working with other community members. It's a wonderful profession, and the enthusiasm that Martha spoke of is what is needed when you go in to look at taking an interview. Thank you.
I don't think I have much to add beyond all of that wonderful advice you just received, except, just if you're interested, give us a call.
Thank you all. So it sounds like, Christina, if you're hesitant, you should do it. This next question is more specific to certification for public health nurses. So this one comes from Liz. She has an MSN in advanced public health nursing, and in the absence of a PHNA board certification opportunity, she's wondering if you would recommend getting a certificate in public health.
I would recommend that. I think that would round out her knowledge base as well as her credentials. So yes, I think that she would learn a lot from that and have a great foundation for public health nursing.
I agree with that too. And I recently spoke with the approver of this continuing ed session, and she said she had a master's in nursing and a doctorate, but she applied to her local community to be health commissioner, and they wouldn't interview her because she did not have a master of public health. So I would think a certification in public health would be helpful to anybody that wanted to work in public health.
Thank you all. And not knowing much about nursing, but knowing more about public health, I would second the need for a certificate in public health as well. Um, this question comes from Caroline. Do any of you have advice or recommendations for how to most effectively partner with public health nursing? Or do you have any lessons learned or exceptional examples of collaborations with medical or community agencies?
So I'll start. I think the first step is, depending on the area you're in, reach out to I fully encourage partnerships out in our community. If anything, we're learning right now how essential and vital those are. We have demonstrated huge success partnering specifically in the Portland area with Portland, I can't think of their name, the health center in Portland. I'm sorry, I can't think of the name right now. But we have worked with them, and that has proved, we worked a lot with them during the Expo Center experience that we had. We would do the assessments and we provided vaccination, and then we partnered with them to make sure that our new Mainers were connected with medical homes. So I think really reaching out to your local districts, and we have that on our website with a list of our local districts and the supervisor in that district. I would really encourage you to start those conversations and forge those partnerships, because I think as we transition into this next phase with COVID, I think those partnerships are going to be essential. We certainly can't do it alone, but we together can support each other and really be effective.
Hi, this is Patty, and I would echo that. Just recently we had St. Joseph's Hospital reached out to us when they learned we were going to be assisting with some farm workers that were coming through, and they offered some help. And as Kate said, we can't do it alone. This is going to make our efforts much stronger and much better and healthier. So absolutely reach out. And I think you would find that most of us are very willing to partner. We have a long history of collaboration and coming together to work to solve those community needs. It really needs all of us, whether it's working with your needle exchange to help get the word out that you're going to provide hepatitis A vaccines, or whatever. Absolutely reach out, and it is on the website. We're pretty easy to find.
Thank you. And I think we have time for one last quick question, and hopefully it's a quick answer. How is Maine CDC recruiting and retaining a strong public health nursing workforce for the present and for the future?
I didn't hear all. I think what the question was, Heather, was how were we recruiting and maintaining and retention? Was that the second part of the question?
Yes.
So our recruitment efforts, we've had several media campaigns that we've done. We have also partnered with some of our colleges. We have, I didn't get to touch on that when I was speaking, but we're working with several colleges. We have several of the colleges that have students that are now working, doing rotations with us, and we're hoping that that will also help. We certainly have, prior to COVID, we did several career centers that we were at. We are working for retention. We have recently been able to have a 15% recruitment and retention stipend that was added to the current pay. So, and that is sustainable. That's not something that was a one-time thing. So that's some of what we've continued to do.
Heather, I have a quote to read at the end, Heather.
Yep, and I was just going to turn it over to you, Martha. We're 1 minute over, so I'll
Okay.
give it to you and then I'll finish with some announcements.
Former public health nurse director Helen Zidowecki was not able to attend today, but sent the following message, and I think it's a fitting conclusion to this panel. She wrote, "I want to express my gratitude to public health nurses for their commitment to health and well-being in the area of public health. As I write, a litany of challenges have occurred in the past 100 years here in Maine and elsewhere come to mind. Political, societal, and economic, as well as the quality and complexity of nursing practice. And be assured that you have, are, and will continue to make a difference in the lives of the people of Maine. Thank you."
Thank you, Martha. And many thanks again to all of our panelists and for everyone for joining with us this morning. We are a couple minutes over, so we'll need to wrap up, but just a few announcements before we end for the day. This is the last session for our conference this morning and for the week. Thank everyone for participating. Please don't forget to fill out the session evaluation. You can find that in the same spot where you logged into the live stream by clicking on the feedback button. It is required if you're seeking CME or ANA credits. And we also ask that you do it just for our own benefit, for our speakers and for our planning committee as we create more events. What's my other announcement? We will be offering closed captioning starting next week for anyone who requires that, and we'll have announcements up on the website so you can access that as well. And we will take Monday off just as we did this week, but we will be back Tuesday, October 13th at 9 o'clock with our first keynote, Lonnie Graham, who will be speaking about mental health, followed by a second keynote by Amanda McKinney, who will be talking about cardiovascular health. So we hope that you'll all join us for that. But otherwise, have a great weekend, and thank you all so much for supporting us and participating in all of our sessions.
Thank you.